Back now with two of the senators who could determine the fate of Obamacare repeal. Senators Rand Paul of Kentucky, Susan Collins of Maine. I want to start with Senator Paul. Senator Paul, thank you for joining us this morning. You and three other conservatives said that the repeal doesn't go far enough. You say the subsidies are too generous. But you just heard President Trump this morning. He kind of conceded that he called the House bill too mean, says he wants a Senate bill with more heart. That seems to be going in the opposite direction of what you're calling for.
Well, you know, the fundamental flaw of Obamacare was that it added regulations to insurance, mandates, which made insurance more expensive. But then it also told individuals, you know what, if you don't want to buy it now, you can wait and buy it after you're sick. That still remains. 10 of 12 regulations that add cost to insurance remain under the Republican bill. And we still say you can still buy insurance after you're sick. If you add those two together, you still get the death spiral. The Republican plan acknowledges that we're going to still have this death spiral, which is sicker and sicker people in the individual market and the healthy people don't buy insurance. They acknowledge this by putting over $100 billion of insurance bailout money to try to say, oh, we're going to tamp down prices. We're not going to fix the problem. We're going to acknowledge the problem will continue forever, and we're just going to pile taxpayer money into it. That is just not a conservative notion to add a new federal program to bail out insurance companies.
That sounds like a fundamental structural flaw in the program that you're talking about. So is there no way you can get to a yes vote?
Well, what we can do is, if they cannot get 50 votes, if they get to impasse, I've been telling leadership for months now that I will vote for a repeal, and it doesn't have to be 100% repeal. So, for example, I'm for 100% repeal. That's what I want. But if you offer me 90% repeal, I'd probably vote for it. I might vote for 80% repeal.
What percent is it now?
Realize that hey, just 1 second. Realize that the Obamacare subsidies in this bill are actually greater under the Republican bill than they are under the current Obamacare law. That is not anywhere close to repeal.
So you're a no right now. You're a no.
At this point, but I could vote if we get to impasse, if we go to a bill that is more repeal and less big government programs, yes, I'll consider partial repeal.
So that means fewer subsidies, lower subsidies?
It means more freedom. It means they have to legalize the sale of inexpensive insurance. Obamacare made it illegal to buy inexpensive insurance. If I have a 27-year-old guy and I don't want pregnancy coverage, I cannot buy an inexpensive policy. They price me out of the marketplace, and therefore I don't buy it at all, and that leads to the whole death spiral of Obamacare. All of that remains under this, and I'm not voting for something that looks just like Obamacare and still doesn't fix the fundamental flaw of Obamacare.
Your colleague, Mike Lee, also says he's a no right now. He says, listen, it's very hard to see how he could get to yes. The only thing he can see right now is giving every state the ability to opt out of Obamacare. Would that fix it for you?
It helps, because what that means is you have the freedom to buy inexpensive insurance. You have to realize the Obamacare mandates, regulations, add cost to insurance, price young, healthy people out of the market, and then you get the death spiral that is Obamacare. So if you get rid of the regulations, you may allow inexpensive insurance to be sold once again, and you may allow freedom of choice. Shouldn't the individual in a free country be able to decide what they want for insurance? The government shouldn't tell you what you should have to buy for insurance.
You've got four conservatives like you who say you're a no vote now unless you get some fixes. As you know, there are also several moderates who are opposed to the Medicaid cuts, including Susan Collins, who's coming up next. She also doesn't like the denial of funding to Planned Parenthood, believes, along with many other moderates, that the subsidies aren't generous enough. So if it moves in their direction, does it lose you?
Well, the way you can do this is, instead of moving in one direction or the other, why don't we take 25 ideas and keep narrowing it until we get 100% consensus. On all 25 ideas or all 1,000 ideas of how to fix health care, there is not consensus probably in any political party. But what if we keep whittling it back to things we have consensus for? Everyone in our caucus is for expanding health savings accounts. Why don't we at least do that? Everybody in our caucus thinks the Obamacare taxes were a punishment on business and opportunity and jobs in our country. Why don't we do that? Everybody in our caucus thinks we ought to repeal at least some regulations. Why don't we repeal some regulations? If there's dissent on Medicaid, why don't we come back in 6 months and say, you know what? Let's work with Democrats and let's do replace the new government programs that y'all want. Let's work with Democrats on that. But let's go ahead and repeal the things Democrats will never do. Democrats will never repeal a tax, and they'll never repeal a regulation. And those are two things that are messing up the marketplace.
Doesn't sound to me like you're going to get to yes this week.
I will get to yes if they change their approach. And will they change their approach if they don't get 50? I think they ought to. Why don't we whittle it down to what the whole caucus agrees on? I think there's a bill that all 52 Republicans agree on if they keep narrowing the focus. They've promised too much. They say they're going to fix health care and premiums are going to go down. There's no way the Republican bill brings down premiums. Look, I've been in medicine 20 years. I'm 54 years old. Premiums have never gone down. They're not going to go down after the Republican bill. And it's a false sort of over-promising to say, oh, yeah, insurance premiums are going to go down, but we're keeping 10 of the 12 mandates that cause the prices to go up. It's a foolish notion to promise something you can't provide.
Senator Paul, thanks for your time this morning.